Thank you, Mr. Chairman. Madam Secretary, I note that you earlier said that with the donut hole that the benefits stop and the payment continues, but of course you understand that's for a small amount of time till they get above a certain amount, and then almost 100% of their benefits are paid for. I think you understand that, so it's not proper to say that their benefits stop, because their benefits...
Well, they stop for a substantial period of time,
Well,
depending on how fast you buy drugs.
Yeah, but anyway, I have two questions, Madam Secretary. The President has indicated that he said, quote, if you like your health care plan, you'll be able to keep your health care, period. No one will take it away from you, no matter what. I have here the Lewin Group has done a study, and it's a bipartisan study, which found that 120 million people, nearly 67% of non-Medicare Americans, would lose their current coverage and be forced into a government-run insurance if a government plan was included. Do you have any evidence that if a government plan is offered, that 120 million people will be able to keep their current insurance?
Well, Congressman, it's my understanding that that Lewin study has been updated and, or at least disputed by a number of people, that those numbers were significantly higher than folks believe.
So your answer is that you dispute the Lewin plan?
I do.
Okay. The next question is then, I have here a study by the HSI Network, LLC, June 24th, 2009. Their study said that the bill we're discussing today would cost an astounding $3.5 trillion. Do you dispute that fact?
Sir, I'm waiting to see what the CBO score says. I don't know the figures that you've just quoted. I don't know who the group is.
Have you seen this report?
No, I have not.
Okay. All right. Now, the President has indicated that if any bill arrives from Congress that is not controlling cost, that's a bill he can't support. So the first question is, you don't agree with this report, you don't know about it, they said it's going to cost $3.5 trillion. Where, if it's not 3.5 or 3.2 or let's say 2.8, where are you going to get the money to pay for this bill?
Again, Congressman, I think that once the bill is scored and once the proposals are put forward, I'm eager to work with the committees in the House and the committees in the Senate to identify the cost savings. The President has proposed about $1 billion worth of revenue enhancements and cost savings that he feels are appropriate to spend on this. There are other ideas that are being proposed by members of the Senate and members of the House, and we're eager to work on.
Well, of course, $1 billion is not going to approach 3.5 trillion.
But, sir,
so $1 billion is just a pittance compared to the 3.5 that this report shows is going to cost. Another question is that you really don't have any idea where you're going to get the money to pay for us. Do you have any evidence that shows if the government spends $3.5 trillion, that it'll save money? Let's not take the $3.5 trillion. Let's just ask you where, if we spend all this money, where are you going to save it?
Sir, I think you start from the premise that we can't afford what we're doing. So not doing anything is not an option. $2 trillion plus a year is being spent, and Americans are less healthy than they were years ago. So we have to change what currently is happening. And I think there's every evidence that the combination of health technology, driving quality, and actually beginning to pay for prevention and wellness, promoting primary care instead of disease care, is a huge cost saver over time. It is effective to have Americans in healthier conditions. It's good for our businesses. It's good for our workforce.
Well, I think
so it will save money.
All the things you suggested, both sides would agree on. What the question is how do we do that? How to reform the system so that there's universal access, universal affordability. But at the same time, we don't have a government program that's going to cost $3.5 trillion that's not paid for, with no statistics to show that it's going to save money. There could be an alternative suggestion, and I just suggest, Madam Secretary, that you read the HSI Network LLC report that came out and go back with the latest report from the Lewin Group. And I think certainly before you come up here, you should have some answer how you're going to pay for this. And with that, I yield back.